Speech sound disorders are any difficulty or combination with perception, motor production, or phonological representation of speech sounds or speech segments. This includes phonotactic rules governing permissible speech sound sequences in a language. Speech sound disorders are organic or functional. Functional speech sound disorders means that there is no known cause to the disorder, whereas organic speech sound disorders means that there is an underlying motor, structural, sensory, or neurological cause to the disorder. So articulation and phonology fall under functional, whereas apraxia, cleft palates, or hearing impairments can fall under organic. My personal connection to this is all of my students are nonverbal, so most of it is because of autism. And some autistic individuals who are nonverbal, it's due to apraxia, but the majority of individuals with autism who are nonverbal and have autism are not because of speech sound disorders. I have some students who are who have Down syndrome who can talk, and it is harder to understand them and it's harder for them to communicate. I would think that this would fall under structural organic because of the way their tongue and everything was formed, but I'm not really sure. I only work with students who are in self-contained, so I feel like it is harder to really know what the cause is and if it is a speech sound disorder. Speech sound disorders can cause children to be at higher risk for reading difficulties because they could have poor auditory, phonologic, or verbal memory skills. They are going to have trouble speaking clearly and being understood, and they could also struggle with controlling their voices. Students with speech sound disorders can struggle socially because of their disability, and it can be harder for them to make friends, which would mean that they could be at a higher risk for bullying.